I'm talking with you about a new study that we did of 20 publics around the world. It's a public opinion survey by the Pew Research Center, and we're a nonprofit organization based in Washington, D.C. We do a lot of international survey research. Now, 20 publics means that we had to try to balance breadth and depth of places. So we had more places in Europe, more places in the Asia Pacific region, and just a few places elsewhere. We had the US, Canada, Brazil, and Russia. The survey was conducted from October 2019, and the very last interviewers were conducted in the Czech Republic in around March, right as the pandemic was really taking hold. One of the things we found is that it was no longer safe to do face-to-face interviews because of the spread of the disease, and so we were fortunate that the surveys conducted in Brazil were finished up before that. One of the core research questions in the survey is really to look at public trust in science and scientists. We often do have some kind of statement that kind of directs the question. So here what we did was we asked people, how much do you trust scientists to do what is right for the country? One of the ways that we're interpreting that is to look at trust in scientists compared with other groups and institutions. So you're also asked how much you trust the military to do what is right for Brazil, how much you trust the government, how much you trust business leaders and the media. Now, Brazil's an interesting case because actually in Brazil, you didn't see that much differentiation, kind of lower levels of this kind of trust in scientists, but you also saw lower levels of trust in other groups. Across the 20 public, generally speaking, trust was higher either for the military or scientists and quite a bit lower for the other three groups, for government, for the media, and for business leaders. And in Brazil, that was also true, but it wasn't as big of a difference. And I believe in general, Brazilians, their level of trust in the military was about the same as their level of trust in science. You know, one of the reasons you're doing that is to be able to look at how public see and value the place of science in society and to be able to make those comparisons across places. Brazilians really stood out for their generally low ratings related to achievement of the country, in scientific achievement in particular, but as well as in medical treatments, as well as in STEM-related education. And really, there were more negative assessments in other areas of the country as well, in terms of the political system, the economy, and so on. Rather small shares said that the country was above average or the best in the world. You saw more people saying that Brazil was about on average compared with other places. So really, the public was generally split between thinking that Brazil was below average versus average. One of the big questions going forward is how much has this changed because of the coronavirus pandemic? And unfortunately, we don't have all the answers to that. These surveys were conducted kind of just before the pandemic really took hold. And because in Brazil in particular, we're surveying face to face, it means that we're not able to go do a survey in Brazil right now. So we're not able to get an update just yet. What we know going into the pandemic is that overall Brazilians had relatively lower views about the quality of medical treatments in the country. About half said that the treatments were about average compared with other places, and 35% thought they were below average. And of course, there's been a tremendous stress on the medical system in Brazil as well as around the world because of the coronavirus pandemic. The Pew Research Center does quite a few international surveys, and they're complicated. I just have to say that. One of the reasons they're complicated is what you're trying to do is to conduct the same survey with comparable language and comparable methods across all these different places and all at the same time, so that you're trying to capture public opinion at the same moment in time. We typically partner with vendors who do the data collection. That's really important because you're working with a professional research organization that knows the local context. And that's one important piece in terms of being able to do this across cultures. Obviously, translations comes up a lot. You're doing a few different things in terms of translations. Number one is you often start with a common language. So in our case, we start with an English language questionnaire, and then we have one set of translators work in that language. So Portuguese. And then you have a separate independent translation service look at that translation and say, does that make sense? Is that grammatically correct? Is that the most appropriate word for colloquial understanding? What we're trying to do then is try to oversee how those translations are working across all 20 places at the same time. One of the things that you tend to do to make it work better is you try to use simpler language. You try to use language that you can translate across different cultures.